CIET NCERT presents the audiobook of Physical Education and Well-being titled Khel Praveen for Grade 9.
Page number 60. Unit 2. Science and Sports. Chapter 8. First Aid. Here a diagram has been given where two students, a male and female, are talking and asking questions to their female coach. The children say, "Ma'am, we often get injured while playing. Sometimes we get small cuts, but at other times we feel pain even if there is no bleeding. What should we do in such situations?" The female coach answers, "That is a very good question, Arnav. Not all injuries cause bleeding. Some affect the muscles, joints, or bones underneath the skin. These are called soft tissue injuries, and they are very common in sports. When you fall and twist or pivot suddenly, the tissues around your joints, like muscles, tendons, or ligaments, may get stretched or torn. This causes pain, swelling, and bruising even without an open wound." Page number 61. There's a simple and effective method to treat such injuries in the first few hours. It's called the Rice Principle, which stands for: here, a table has been given with 3 columns, each column titled Aspect, Action, Purpose or Benefit. The 4 aspects of the Rice Principle are mentioned here. The first is R, that is, rest. Action: stop playing or putting pressure on the injured part. Purpose or benefit: prevents further tissue damage and starts healing. I stands for ice. Action: apply ice for 10 to 15 minutes every 2 hours. Purpose or benefit: reduces pain and swelling. Always wrap ice in a cloth. Aspect C, which is compression. Action: wrap with an elastic bandage. Purpose or benefit: limits swelling and provides support. Aspect E, elevation. Action: keep the injured limb raised above heart level. Purpose or benefit: helps fluid drain away and reduces swelling. Another diagram has been given at the bottom of this page, wherein 2 young children are asking questions to their female coach. The girl asks, "Ma'am, you told us about rice. I noticed something called price, police, and peace and love while browsing the internet. Which one is correct?" "Good observation, Ishita," answers the coach. "Rice is the basic version, but sometimes we use an improved method called price. It adds protection for P as the first step. For example, if you twist your ankle, stop moving immediately and protect it with a support or brace before applying rice. Police and peace and love are newer methods used during long-term recovery. But for first aid in school or on the playground, price is simple, effective, and easy to remember. Page number 62. Did you know? P stands for protection. Avoid activities and movements that increase pain during the first few days after injury. E for elevation. Elevate the injured limb higher than the heart as often as possible. A stands for avoid anti-inflammatories. Avoid taking anti-inflammatory medications as they reduce tissue healing. Avoid icing. C, compression. Use elastic bandage or taping to reduce swelling. E, education. Your body knows best. Avoid unnecessary passive treatments and medical investigations and let nature play its role. And love, wherein L stands for load. Let pain guide your gradual return to normal activities. Your body will tell you when it's safe to increase the load. O stands for optimism. Condition your brain for optimal recovery by being confident and positive. V stands for vascularization. Choose pain-free cardiovascular activities to increase blood flow to repairing tissues. E stands for exercise. Restore mobility, strength, and proprioception by adopting an active approach for recovery. Page number 63. Did you know? Protection. Rather than totally resting the injured area, think more about protecting it from further damage. A short period of rest immediately after an injury is helpful to unload the injured area, but total rest should be limited and combined with optimal loading. Optimal loading. Early activity encourages early recovery. Progressive loading of your injury can help promote optimal healing. It can prevent delays in returning to normal that may develop with prolonged rest, such as joint and muscle tightness or muscle wasting. Ice. Applying ice may help to manage the swelling around your injured muscle or joint, and it can help decrease some of the acute pain that you may be experiencing. Icing every few hours for up to 20 minutes at a time is great for the first few days. Compression. Applying a compression bandage evenly to the affected area may help reduce any swelling you may have. You can combine this with ice. Elevation. You can elevate the area during short periods of rest, again to help with swelling and reduce the pain. Make sure the injured part is elevated above the level of your heart. Activity. Identify and respond. Form small groups in your class. One student will act as an injured player, and the others will act as first aiders. Act out the following scenarios in your group: a twisted ankle, a fainting student, a nosebleed. Use the Price method, stay calm, and make sure to call for help when needed. After the activity, discuss with your class. What did you do well, and what could you have done better? Page number 64. The teacher then picked up the school's first aid box from their desk and said, "Now that we have learned how to manage injuries, let us understand the most important part." Here, the picture of a first aid kit in pink color is drawn. What is first aid? First aid is the immediate care given to a person who has been injured or become suddenly ill before medical help arrives. It includes simple actions that can sometimes save a life. The purpose of first aid is not to diagnose or fully treat the problem. It is to provide stability and safety until professional medical care is available. Anyone with basic first aid knowledge can make a difference. In fact, studies show that trained individuals can greatly reduce deaths and disabilities worldwide simply by acting quickly. Here, a figure has been given at the end of this page, showing two children talking and asking questions from their female coach. The girl asks, "Ma'am, so even if we are not medical professionals, we can still save lives?" The female coach replies, "Exactly. That is the power of first aid. It is about helping immediately, calmly, and wisely." Aims of first aid. The teacher wrote 3 big letters on the board, P, 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 and explained. First, preserve life. The first aim is to keep the person alive by ensuring they can breathe, their heart is beating, and bleeding is under control. Page number 65. This page has figure 8.1, wherein first aid components have been drawn. Various components used during first aid are drawn here. The given components are in 3 rows. These are bandages, gauze roll and pads, instant cold pack, elastic bandages, adhesive tape, emergency blanket, thermometer, first aid manual, bandage, gloves, antiseptic wipes, safety pins, tweezers, scissors, and and emergency contact information or medical information for family members. Second, the next P is for prevent worsening. The second aim is to stop the condition from getting worse. For example, by using the Price method for injuries or by controlling bleeding in case of cuts. 3. Promote recovery. The third aim is to comfort and reassure the injured person and help them recover until professional help arrives. Here, a diagram has been given wherein a female coach is describing the 3 Ps to 2 students. The female coach says, "These are called the 3 Ps of first aid. Remember them always. They guide every step of emergency care." Page number 66. Golden Rule of First Aid. The following are the golden rules of the first aid which everyone should follow. 1. Stay calm and think clearly. Explanation or action. Panic spreads faster than injury. Stay calm, take a deep breath, assess the situation, and think before acting. A clear mind saves lives. 2. Ensure safety first. Your safety comes first. Check for danger, like live wires, fire, sharp objects, or traffic, before helping. Never become the second victim. 3. Call for help early. Whether the injuries are serious or common, call for medical help immediately. In India, dial 112 for emergency services. While waiting, begin first aid or CPR if needed. 4. Give immediate and correct first aid. Follow the 3 Ps of first aid. Preserve life, prevent worsening, promote recovery. Use BLS or CPR for breathing or cardiac emergencies. 5. Handle with care. Never move an injured person roughly. If a head, neck, or bone injury is suspected, keep the person still and wait for trained help. 6. Use what you have. If a first aid box isn't nearby, use available materials. Clean cloth for bleeding, a folded magazine as a splint, or a towel as a sling. Presence of mind is more important than tools. 7. Stay with the person. Stay beside the injured person. Talk to them, reassure them, and keep them conscious. Emotional support reduces shock and fear. A diagram has been shown here wherein 2 children are talking about first aid with their female coach. The female coach tells the children, "Always remember, the goal of first aid is not to fix everything, but to help someone safely until professional help arrives. Your calmness, confidence, and care can save a life." The boy asks, "Ma'am, in the previous explanation you wrote the word CPR. What is it?" The female coach replies, "We will discuss about basic life support in next period." Page number 67. Basic life support, BLS and CPR. The next day, during the physical education period, the teacher brought a mannequin and some first aid charts to class. The students were curious. Understanding basic life support, BLS and CPR. BLS means giving immediate help to someone whose heart or breathing has stopped until professional medical help arrives. It includes CPR, cardiopulmonary resuscitation, and the use of an AED, automated external defibrillator, if available. The teacher explained. Here a diagram is given where the teacher is explaining to the children. One of the most important life-saving skills is basic life support, also called BLS. Sometimes, when a person suddenly collapses, stops breathing, or loses consciousness, what you do in the first few minutes can save their life. Aims of BLS and CPR. 1. Restore breathing. 2. Maintain blood circulation. 3. Keep oxygen supply to the brain and vital organs. The DRSABCD Action Plan. The teacher showed a poster with the letters DRSABCD and explained them step by step. Page number 68. A figure has been given here explaining the DRSABCD method. A column has been given wherein the letters D, R, S, A, B, C, D are written. In front of each of the letter, a figure has been drawn. What is to be done in this method? In front of the image, the explanation of this alphabet has been given. The first alphabet is D. The explanation is check for danger. Ensure the area is safe for yourself, bystanders, and casualty. R. Check for response. No response. S. Send for help. Call 112 or ask another person to call. A. Open the airway. Check for airway obstruction. If debris is present, roll the casualty to the recovery position and clear. To open the airway, tilt the head back and lift the chin. B. Check breathing. Look, listen, feel for 10 seconds. Not breathing or breathing abnormally. Normal breathing. Place in the recovery position and monitor breathing. C. Stands for CPR. Start CPR. 30 chest compressions plus 2 breaths. Here, a table has been given explaining the various methods of doing CPR on adults, children, and infants. There are 4 columns in this table. The first column has various aspects of pressure, depth, rate, and breadth. The next 3 columns are for adult, persons with age of 8 years and above, child with age above 1 year, infant with age less than 1 year. Pressure for adults with 2 hands, depth 5+ centimeters, rate almost 2 compressions per second, 100 or 120 compressions per minute. Breath 2 full breaths with head tilt and chin lift. For a child, pressure with 1 or 2 hands, depth 5 centimeter, rate almost 2 compressions per second, 100 or 120 per minute, breath 2 shallow breaths with head tilt and chin lift. For infants, that is, for children of less than 1 year, pressure of 2 fingers, depth 4 centimeter, rate almost 2 compressions per second, that is 100 to 120 compressions per minute, breath 2 puffs with no head tilt with slight chin lift. The letter D stands for attach defibrillator, that is AED. Where an AED is available, attach it as soon as possible and follow the instructions. Continue CPR and defibrillation until signs of life resume or medical professionals take over. Page number 69. Activity. Practicing CPR. Form groups in your class. Take turns practicing chest compressions on a mannequin. While performing the compressions, say the rhythm aloud. Push, push, push. 1, 2, 3. Remember to maintain the correct depth and pace with each compression. Golden rules of BLS and CPR. 1. Stay calm. Panic wastes time. 2. Call for help immediately. 3. Start CPR without delay if the person is unresponsive and not breathing. 4. Never give up until medical help arrives or the person recovers. 5. Always protect yourself. Wear gloves if available. Here, a diagram has been given where two children are talking with their female coach. The children ask, "Ma'am, I often get nosebleeds, especially during the summer or when I play outside for a long time. What should I do when that happens?" The female coach replies, "That's a good question. A nosebleed is quite common among children and athletes. It usually happens when the tiny blood vessels inside the nose burst due to dryness, heat, injury, or too much pressure from blowing the nose. But don't worry, it can be easily managed with proper first aid." Page number 70. The teacher then explained step by step. Figure 8.2 has been given here, which tells how to stop a nosebleed. Various figures have been drawn to describe the various steps of stopping the nosebleed. Step 1. Pinch the fleshy part of the nose just below the bone using your thumb and index finger. Step 2. Sit down and lean slightly forward to prevent blood from flowing down the throat. Step 3. Maintain pressure and posture until the bleeding stops. Step 4. Sit and rest for at least 10 minutes. A diagram has been given here wherein two children are again talking with their female coach. The coach says, if the nosebleed does not stop even after 10 to 15 minutes, or if it happens often, you should see a doctor. Sometimes frequent nosebleeds happen due to dryness, allergies, or weak blood vessels. The girl asks, "Ma'am, can it happen because of playing too much in the heat?" The coach replies, "Yes, hot, dry air can dry out the lining of the nose, making it fragile. That's why it's important to stay hydrated. Avoid picking your nose, and if needed, apply a little petroleum jelly inside the nostrils during very dry weather." Page number 71. Activity. In a group of 4 to 5 members, practice the transfer techniques given below and explore when to apply which of the techniques to transfer the injured person. Also, discuss with the teacher about the accuracy of both the transfer and injury. Transfer techniques. Transfer techniques in first aid are methods used to move an injured person safely from one place to another without causing further harm. Before transferring a casualty, it is important to ensure that the area is safe, check the person's condition, and call for medical help. An injured person should not be moved if a spinal or neck injury is suspected, unless there is immediate danger. There are different transfer techniques depending on the situation. Let us understand those given in figure 8.3. Exercises. 1. A student fell during a football match and injured their ankle. What immediate first aid steps should be taken? 2. During a sports event, a player becomes unconscious but is breathing. What should you do? 3. What items should be included in a basic first aid kit? Page number 72. Rules of first aid while moving. Various figures have been shown here. In figure 8.3, various transfer techniques have been drawn. These are given in a proper order. First image drawn here gives the illustration of a boy falling down from a set of ladders and fracturing his spine. The next step is hold the head. Next, extremity lift, chair litter carry, and handed seat. 3 illustrations give 3 techniques of transferring the victim. Now, blanket drag, shirt drag, neck drag. These 3 are also transfer techniques given how to carry the victim. Page number 73. An injured victim. 9 sets of images have been illustrated here. Each of the image describes as to What is to be done to an injured victim? The explanation of each of the image has been written beneath the drawing. First, roll victim to side and place blanket. Next, lay victim flat on the blanket. 3. Move victim by holding the corners of the blanket. 4. Flat lift and carry. 5th, a walking assist. 6th, lift and carry. 7th, fireman's carry. 8, pick a back. And 9, arm lift. Various lifting techniques to transfer an injured victim. Page number 74. Check your progress. Answer in brief. 1. Compare voluntary and involuntary muscles with examples. 2. What happens to muscles when you exercise regularly? 3. What changes occur in breathing and pulse rate when you run compared to when you rest? 4. Design a circuit training to improve cardiorespiratory fitness. 5. Growth stops after a certain age, but development continues throughout life. Explain the statement. 6. How can lack of sleep affect growth and development? Answer the following in detail. 1. Explain how bones and muscles work together to produce movement. 2. What happens to muscles when you exercise regularly? 3. How does regular physical activity influence growth during adolescence? 4. Explain how emotional development changes during teenage years. 5. Why is it important to stay calm while giving first aid? 6. Design a simple awareness poster on the importance of first aid in daily life. 7. Explain how the heart and lungs work together during physical activity. 8. Why is cardiorespiratory endurance important for overall health? Chapter 8. First Aid ends here.
Khel, Praveen, you were just listening to this audiobook, Textbook of Physical Education and Well-Being for Grade 9. Narrator, Vaibhav J. Srivastav. Sound recordist, Muhammad Faizan. Assistance in production, Soumya Malik. Directed and produced by Vimlesh Chaudhary. This audiobook is brought to you by CIET NCERT, New Delhi, India.